During outbreaks of Ebola, the disease can spread quickly within healthcare settings. Some of that is because staffs might not be wearing the proper protective equipment, including masks and gowns and gloves and eye protection before a diagnosis. ABC 15's Angie Holdsworth is taking action this morning to see how isolation rooms are being prepared now at hospitals. Angie?
Yeah, really, there's a lot of things that are being done that really is kind of business as usual if you ask the healthcare workers here in the Valley. Now, I'm here in Tempe where a nonprofit is actually sending a lot of basic medical supplies to Liberia and to Sierra Leone, just because those are the things that can make such a difference. But again, here in the United States, some of this might be just seen as a routine situation. We went to Maricopa Integrated Health Services. They say once they identify a patient that has any kind of infectious disease, tuberculosis or that type of thing, they go ahead and put them in a room, they isolate them from everybody else, and it's a room that has a controlled airflow so that air does not get back into the general population. And then the staff basically suits up with protective gear. They use the coverings for their feet, for the gowns, they wear a mask, anything just to protect themselves. But they say it really is not so unusual.
It's really, all hospitals in the nation are equipped to handle transmission-based precautions, and Ebola is just one of them. So it's really not different than normal procedures that we would take.
Now, you're not going to see the hospital workers in those big white kind of protection suits that we've seen sometimes on TV. That type of situation would only happen in a mass disaster type of situation. So that might be just a little bit of a Hollywood approach toward it, if you might want to say. But really, they say there's really not a lot of reason to fear because it's something they do every day.